Hello my friend, welcome to my channel. It's IncoInfoTuber. This is the part 3 video of scapula, in which in this video I will explain the ossification centers and the clinical anatomy of the scapula. In my part 1 video, I have briefly explained about the features and the side deformation of the scapula, and in my part 2 video I have explained briefly about the attachments of muscle and ligaments with scapula. If you have not watched that my part 1 and part 2 video, please kindly check my description. I have dropped a link below. Click on the link to watch that video. If you didn't get that link, please kindly check my channel. In my channel, I have created a separate playlist for upper limb bones. Before we start our part 3 video, please take a minute and kindly please subscribe my channel and share to your friends. I hope these videos will help you to revise in your exams and learn thoroughly, because the basics are very important to become a successful doctors. Okay, let's start our today's explanation about the ossification and clinical anatomy of the scapula. Okay, ossification in scapula. Scapula ossifies from one primary center and 7 secondary centers. The first one primary center appears near glenoid cavity during 8th week of development. One primary center appears near glenoid cavity during 8th week of appearance. Next, 7 secondary center. In that, the first secondary center appears in the middle of coracoid process. In the middle of coracoid process, there is appearance of a secondary center in which it gets fused by 15th year. The subcoracoid center appears in the root of coracoid process during 10th year, fuses by 16th to 18th years. Okay, the subcoracoid center appears at the root of the coracoid process, in which it appears at 10th year and later it fuses by 16th to 18th years. Okay, the other center, there is a presence of other centers also, in which the 2 for acromion process. There is a presence of 2 center for acromion process, that is ossification of acromion process, and 1 center for the lower 2/3 margin of glenoid cavity. Lower 2/3 margin of glenoid cavity, there is a presence of 1 center for ossification and the another 1 center for medial border. For medial border, there is a presence of another ossifying center. The another one ossifying center is there for inferior angle. Okay, the another ossifying center is there for inferior angle, and this appears at puberty. Okay, and it get fuses by 25th year. Okay, so the ossification is like from here to here and from here to here, from here to here and from here to here. It just comes like this. Ossifying, the bone formation is from like this. Okay, it ossifies like this and like this. The bone get ossifies and fuses at a particular ear. Remember that ear, and please observe this explanation during your exams and hear it again and again so that it will remember in exam. Next, clinical anatomy of scapula. Paralysis of serratus anterior causes winging of scapula. The medial border of the bone becomes unduly prominent and arm cannot be abducted beyond 90 degrees. The another clinical anatomy, the scaphoid scapula. It is a developmental anomaly in which the medial border is concave. The above given picture is a paralysis of serratus anterior which causes the winging of scapula. And I have showed that in my previous video, where does a serratus anterior placed. And you also know the medial border in which this affects and the person cannot abduct beyond 90 degree. So that's all for today's video. I hope you have learned everything what I have explained. If you haven't learned, please learn this. These are the basics which you should know as a doctor, and if you learn and keep it aside, you can give concentrate to other subject which you don't know. And later you can revise it again and again, everything day by day. So till now we have completely finished the clavicle and bone scapula. Okay, in my next video I will explain the humerus, and my next video will be uploaded after 2 days. Until that, you study and finish this much portions of the bone. So if you feel this video is helpful and education and in learning purpose and while revision, please kindly subscribe and share this video to your friends. See you on my next video. Until that, bye bye. Thanks for watching.